Hey, Dr. K, good morning, sir,
Good morning, Jack.
and Happy New Year. I know that people hear you all the time on our station, and sometimes we sort of fill you in on some of your background, and mostly we don't, but you're a retired physician from Somerset, and you also started an organization that has become a national one called Health Watch USA. Tell us about Health Watch USA.
Well, we're a nonprofit organization. As you said, national. We concentrate on healthcare policy. We've done a number of policy research articles, and we also concentrate on patient advocacy. And we've been around over a decade now, meet regularly, and we're starting to get some international exposure. In fact, just this morning I had someone from Moscow wanting to join.
Wow.
Yeah, we'll see what happens there. But it's something that has really grown. And because of my past profession, that being ear, nose, and throat, 50% of what I did in that profession was infectious disease. I have maintained an interest in that, did a lot of research, and that's why with the coronavirus, we have really geared up and engaged in this initiative.
We talked a little bit about, and we appreciate all the time that you have devoted to this. And I know some people think you're too negative. I view you as a man of science that just talks about the facts, and I don't think you ever intentionally bring politics into the equation at all. You're just kind of a guy that tells it like it is. But anyway, we talked yesterday a little bit about this, what they're calling a variant that has now turned up in addition to our own country, Canada and France and Japan and Spain and Sweden and several other European countries. According to the World Health Organization, it's called B117, whatever that means. Talk about that a bit for us. Is that going to be worse, or will the vaccines that we now have, will that take care of that variant? What do you say?
Well, in all likelihood, it's not going to produce worse disease, at least that hasn't been observed yet. And the vaccines should be effective because they make a multiclonal or polyclonal antibody response, many different types of antibodies to that spike protein. And it's very difficult for the virus to evade all of those antibodies and at the same time maintain its infectivity to be able to attach to the ACE2 receptor of the cells in the body. So, in all likelihood, the vaccine will be effective. If you catch the virus, the problem there is that you may have a filled hospital because it is so infective. It is causing a surge in cases in many countries, and this may be what's happening right now in California. So, its infectivity is what is so dangerous here.
More contagious and yet not worse than the original strain. Am I reading that right?
Yes, and this is hard for people to understand. We've talked about it before, but a pandemic's lethality or the havoc it causes on society is a function of its infectivity and its ability to cause death once you get infected. And if a virus is highly lethal, let's say Ebola, it tends not to be very infectious as far as being able to spread easily because people get sick rapidly, they tend to die, and the pandemics oftentimes will burn out because people can adjust their behavior. But when you have a virus where so many people are asymptomatic, they're carriers, they can spread the virus, this then becomes very problematic because the virus spreads. Last year, I think it was, and this was before the pandemic, I had seen a report and it was a documentary on pandemics, and they pegged the lethality of the virus, which causes the most havoc, at 1%. That was the sweet spot where it would spread the most, be very hard to stop, but at the same time still cause significant disease and disability in the population. And of course, what I want to underscore is that we've spent far too much time looking at people who have died rather than people in the hospital and ICU and the chronic problems that this virus can cause. And also that this is as much a heart and vascular virus as it is a lung virus. So we need to take this seriously. For me, tomorrow's going to be December 32nd, and that's how I look at it.
Well, there's a nurse in San Diego. You had referenced California a minute ago. San Diego nurse who, 1 week after being vaccinated, has now gotten the virus. 45-year-old male nurse got first dose of the vaccine December 18th. 6 days later, he felt symptoms like chills and muscle pain and fatigue. And the disease experts say that there are several possible explanations. The first is the vaccine shot provides only about 50% protection anyway, while the second shot bumps it up to 95. Also takes 10 to 14 days for the protection to develop, and it's possible that this nurse was infected before getting the vaccine. But does this slow down your hopes for when the virus might finally get under control?
Well, it really doesn't. I mean, I really wonder why that even made a news story, because just as the items that you said, but there's also a third item, and that is that many people do not feel that this type of vaccine is actually going to prevent that person from acquiring the virus and possibly for a short period of time spreading it, because it really does boost your IgG immunity. It prevents a viremia, prevents you from getting severe infections, but it really doesn't do much to create IgA immunity, different response to line your nose with antibodies to prevent you from getting an infection. So you kind of have to get an infection first before your body kicks in and squelches it. And so that little period of time you may be infectious, which is one of the reasons why if you get the vaccine, you still need to wear a mask. That's very important. And of course, we want to make sure that if you can, to get the second vaccine. And I said if you can because there's now beginning to be some talk to try to get the vaccine out there very quickly, is to maybe vaccinate people just on the one dose initially, picking up the second dose later on. And what I'm worried about, Jack, is that our health departments have been chronically underfunded. They're going to have a hard time just delivering the doses that we have. They have to get up to do that to get people their first dose. And in 3 weeks, they're going to have to be giving out second doses. So it's almost like they have to double the staff just to tread water.
Yeah, I hadn't thought about that.
Yeah, well, no one's talking about it. And it's a pretty obvious problem. When they're talking about problems they're having and we're gearing up, it's like, well, in 3 weeks, you better double, or how are you going to give out the second dose? And those people may be more likely to get a local type of reaction or a vaccine type of a fever or something happening because the second dose is sometimes worse than the first as far as reactions. At least with my shingles vaccine, it was. And so this is something that's of concern. So I'm not really that concerned about that nurse's report, but I do think we really do need to gear up our health departments. And warp speed to me was a disappointment. We've talked about this many times earlier in the year, the idea of manufacturing at risk and gearing up for distribution. So at the get-go, they could get out all these vaccines. Well, it appears that we're in the same situation we were with testing, masks, PPE earlier in the year. Everything is slow getting out. And of course, during a deadly pandemic, it can't be fast enough. So people do need to hang on. The good news is you know how to stay safe. So let's stay safe. Let's not go out and party tonight. It's a good night to look at, tomorrow being December 32nd. I've seen articles saying that this is probably one of the most dangerous times of the year because of the type of behavior that people may display over the New Year's celebrations.
And the state auditor in Kentucky, Mike Harmon, tested positive after he got the vaccine the next day, and now people are going to go, I see it causes. No, it doesn't. It's like the nurse in California.
Yeah, it's problematic. You hear all the time about vaccinations, and unfortunately, we need to get people to be vaccinated, probably 85 to 90%. And I think you can go the high end of this with this new variant that's more infectious in order to get herd immunity. And so people really need to get out there and get the vaccine. What we don't want to happen is for this virus to keep mutating and hit that rare combination where they could evade the vaccine. It may happen, but hopefully that'll happen years down the road. And by that time, people will be getting yearly or every other year shots and they'll be able to print out a new vaccine. So right now, we got to obey public health advice. We need to get the vaccine. The Pfizer vaccine has had millions of doses given already. And Jack, there have been extremely few incidents, mainly allergies. that have occurred quite rapidly, all of which have been treatable. Nobody's died of them, and they've been, less than 10, single digits. So let's get this vaccine.
All right, Dr. Kevin Kavanagh, thank you so much, and Happy New Year to you.